80 key players in the local health sector are hoping to put all the talk behind them and get started on a universal healthcare plan. And they're using a one-day conclave as the springboard to make this happen. The idea is to review and discuss a proposed strategy for universal health coverage to ensure that everyone receives and have access to high-quality care. Acting Chief Medical Officer DeLon Brennan says the present and future health of Bahamians depends on such, particularly considering that chronic non-communicable diseases continue to rise in the country.
People are finding themselves still sick with issues like diabetes and cancers, hypertension, strokes. Those are types of issues that we know we can address. We have the medical capabilities to do so, but we need to be able to get people in to get the type of preventative care and or curative care that they need at the time they need the service. One of the biggest barriers to doing so is actually them being able to pay for it. So what we are trying to do as much as possible is say that we're going to remove the barrier of the need to pay at the time you want to access the care from you not being able to get the type of care that you need. And so that's the biggest part of it, is improving our access to care, to high quality comprehensive health services, and also decreasing the cost that people have to pay when they present themselves at the time for care.
Now, experts will tell you that implementing universal health coverage comes with its challenges given the practices within the current system here in the Bahamas.
I think there are essentially two places that we're really looking to improve the amount of funding that we have available to pay for care. One is decreasing the amount of wastage we have in the system. We know that because we have such a fragmented healthcare system, both fragmented in the private sector because of the multiple providers and the multiple places you need to access care, even for one person needing different parts of their care, need to go to so many different places, but also within the public health sector, we have a primary healthcare sector that is separated from the public tertiary and secondary care centers. And so because you're not the same person or the same patient, either by record number or name in each of those sectors, it means that we have this high administrative overhead and a lot of redundancy in the systems that we could minimize. So that type of wastage that we can eliminate in the system will mean that there's more money available to actually provide care services to people.
He added that having an archipelago country presents its own issues and unique challenges, as it's almost impossible to duplicate all the services needed for each island. It's for this reason, he said, that strategies will be implemented to ensure that everyone has access to healthcare services. During Monday's conclave, participants divided into workshop groups focusing on 4 proposed strategic directions: health governance, health systems and services, health financing, and social determinants to health. The proposed strategy is expected to be presented for consideration at the 53rd Directing Council of the Pan American World Health Organization, scheduled to be held in Washington, D.C. in October. Reporting for JCN News, I'm Greg Smith.